going to demonstrate the mixing medications in one syringe. So the purpose of doing this is to first to prevent the patient experience be injected twice if the medications or the medicines are compatible to be mixed. The two drugs are often mixed in one syringe and given as one injected. So also next was to the nursing considerations. And also the nurse should consult a pharmacist or check a compatibility chart before mixing the drugs. And the nurse must also exercise the caution when mixing the short and long acting insulins because they vary in content. So to assess the client allergies to medications, check the client's allergies to medications, the specific drug action, side effect, interactions, and the adverse reactions. The client knowledge of and learning needs about the medications that we're going to administer, and the intended route of parenteral medications to determine the appropriate size of syringe that we're going to use with the patient, and the needle for the client, and also the ordered medications for clarity and the expiration date to determine that the two medications are compatible with each other to be mixed in one syringe that we're going to administer to the client. So now we're going to wash my hands, so I'll be back. Now I am done washing my hands, so I am going to check now the MIR chart. So according to the chart, I need to give medications or to administer the client a two vials, which is the ampicillin, sodium, or the ampicin. So this is a 250 milligrams. This is a powdered for injection. It's for IM or intramuscular or through intravenous. So this is an antibacterial. So I have here two. And also we have here the ampules, or this is our ranitidine hydrochloride, or the Ranarex. This is also a 25 milligrams. So this is a H2 receptor antagonist. This is also will be given through intramuscular or intravenous. So I am going to check the clarity, or if there is any damage on the medications that I am going to give to the patient. So as I've seen on the ampules, it's clear and no crack or anything. And for the expiration date, it would be on April 2022, written here. So next, I am going to look for the vial, which this is the ampicillin sodium or the ampicin. So the expiration date was also on February 2023, written here. So now I've done introducing this. So now I am going to clean the top of the medicine or the vials. So as we all know, may mga maybe there is may mga alikabok on the top of it. So to avoid, insert it on the through the alcohol pad or the alcohol swab or the to clean here. So I'm going to throw it here. Next is the another alcohol pad. So I've done cleaning with those. So now I am going to mix the sterile water to the ampicillin or the vial, which is this is a powder. So first, okay, I am going to open it. Oh, sorry. So now I am going to get a 2 ml of the sterile water. So avoid the touching the needle by the sterile water to avoid a cross contamination. So let me do. Okay, so I'm done. So since there's an air inside it, I'm going to remove that air slowly through the plunger. So now I am going to put this on the vial. So first I am going to close this one using one hand technique. I'm going to open now the vial. Okay, so I am going to clean it again through the alcohol pad, top of it. Okay, now I am going to open the sterile water and I am going to put it inside the vials. So always remember that the needle shouldn't touch the vials or the powder inside it to avoid cross contamination. So I'm done, and now I am going to get another sterile water that I'm going to put inside to the another vial. So now, since there's air also, I am going to remove that air. Okay, so I am going to put it inside to the another vial. So make sure that the needle won't touch the medicine inside. So I'm done. Then I am going to put it back, the needle, or to close the syringe. So now I am going to mix this through like this, so that the sterile water and the vials will mix, but slowly. So it's already mixed. Now we're going to mix the other vial slowly. So the reason why we need to mix this one is, as we all know, baka may mga buo-buo po na mga powder pa here. So it will be hard for us to get or to be on the syringe. So I've done now. So next, I am going to get the vials and put it in the needle. So we need to withdraw 2 since we need so we need a 2 ml of the vial each. So I am going to withdraw a 4 ml air, so that it will be easy for us to get the vials. So since it is rubbing here. Okay. So now I've already administered the 2 ml of air. So now I'm going to admit it to here. Okay, so I'm going to close this using one hand technique. So I'm going to remove the needle and change it to another one, since now we're going to mix. So we're going to put it through with the use of plunger. Okay, so we've already here. So we're going to, since there's a bubbles, we're going to flick it slowly. Then we're going to remove the air. Then we're going to close this using one hand technique. So now we have here the what we call this, the medication card. We're going to put it here on the top of it, which means that something is written in the medication card, the name of the medicine, the date today, and what time will be given it, and also the assigned nurse. So it was written here, the ampicillin sodium ampicin antibacterial, March 10, 2022 at 8 a.m. and my surname, which is Cabaluna. So we're going to put it here on the side. So I have here now the next, which is the mixing the vial and the ampules. So first, I have here the gauze pot, which I am going to use to open the vial, the ampules. So I've already cleaned the top of it. So now I am going to open. So now I am going to to open the syringe. And I am going to administer 2 ml of air inside the vial. So avoid touching the tip of the needle in the medicine. So now we're going to get so now we have the vials inside the syringe. Now we're going to close this using one hand technique and change the needle, since now we're going to get the ampules. So now we're going to get the ampules here. Okay, so now we have to remove the air. Then since there's a bubbles, we're going to flick it. Then now we're going to close it through one hand technique. So the reason why we need to use a one hand technique, for us, for example, someone passed by in front of us, then we are inserting this, in the reason we can inject accidentally our tip of the hands. So it will be safe if we're going to use a one hand technique. So now we're going to put the medication card, which is also written here, the one this is a mixtures of one vial and the one ampule, which is the vial is the ampicillin and the ampules is the Ranarex. So we're giving, this was assigned to be given on 8 a.m. March 10, 2022 by yours truly, or by me, which is Kabalina. So we've done now with the procedure, and that's all for today. Thank you po.